And for the field of bioethics, it can be said that the modern interest in the ethics of human experimentation rose from the ashes of these experiments. Now, Leo Alexander was a Boston physician, and he was assigned to the Office of Chief Counsel for War Crimes in 1946 and 47. And as such, he participated in the Nuremberg medical trial of 23 physicians. He was serving as the chief consultant. And it was his first chilling account of how, in a remarkably short time, the moral, ethical, and religious values of physicians and scientists were subordinated to the ideology of dictatorship. He published this in a very famous article in 1949. Well, in the concentration camps, hideous experiments were carried out under the guise of medical research. The descriptions of many of these experiments have been taken from the testimony that was actually given by the Nuremberg medical trial. And I've included a few photographs, and I have to warn you, they are quite graphic. And they're taken by the doctors themselves. And I'm including them not to shock you or disturb you, but really to demonstrate what can happen when rights and welfare of people are disregarded. Here's an experiment where it was motivated by a desire to develop treatments for the German military personnel. They wanted to know what happened to pilots who were flying at very, very high altitudes and might have to eject from their airplane. So in these experiments, subjects were placed in a low-pressure chamber, and thereafter, the simulated altitude was raised. Victims suffered at first ruptured eardrums, and then many, many more grave injuries as their lungs exploded. Autopsies were immediately performed, and many could look at the emboli that appeared in the prisoners' brains. This is a case of seeing how long people could survive in ice water. So people were put in ice water and just measured how long it took for them to freeze to death. At several of the camp's experiments were performed regarding starvation experiments or using seawater as the primary liquid. And actually they were conducted with the knowledge of what the obvious and expected results would be. And perhaps one of the most notorious of the doctors of infamy, as they were called, was Joseph Mengele. He was often referred to as the angel of death. At Auschwitz, which had a population of 500,000, he found many outlets for his sadistic tendencies. He was a geneticist, so he was very interested in genes, and particularly he found identical twins, particularly perfect subjects for his research, because there he could perform the research on one of them and then use the other one as the control. So among his experiments were the attempts to change dark hair to blonde hair, change brown eye color to blue eye color by injecting dye into the iris, and to change sex from male to female. Now, Leo Alexander lists many other experiments, and the tests he concludes were totally unnecessary or whose results could have been predicted by simple chemical experiments or were designed simply with one end in mind, and that was death. And now we have a very perplexing question. Should any of the results of these hideous experiments be published in the literature? For example, is it important to know how long people can endure being in freezing water before they die? And so journals have debated whether or not to publish these experiments, and they're still at this moment deciding not to, but perhaps we should. That's a question. Well, in response to the account of the medical science under dictatorship, a most important document emerged from the Nuremberg trials. It's called the Nuremberg Code, and it was written by U.S. judges. It's important to know judges who wrote this code, who participated in the trial, and it actually applies international principles of common law. There were 10 principles that came out of this code, and they're like the 10 commandments of modern human experimentation. Voluntary consent is discussed in the first item, and clearly, when you read the Nuremberg Code, you see that this is where the greatest emphasis is placed. Voluntary and informed consent is considered essential for human experimentation, and it is this principle of autonomy or self-determination that was so flagrantly disregarded in the Nazi experiments. Now, the Nuremberg requirements stipulated that there were 4 requirements for informed consent. So first, consent must be given by a competent person, must be based on adequate information that you present to this person. It must be based on understanding of that information by the person, and it must be given voluntarily. Informed consent must always be given voluntarily, without coercion or undue influence. Now, informed consent also has an escape clause that includes a statement that informs subjects that they may terminate their participation at any time. This is a very important clause. Now, if you looked at these 4 requirements, you'd say, well, that's pretty easy to provide informed consent. What's the problem? But many would say, really, this is one of the most difficult aspects of any research study. And in fact, there are some who claim it's really impossible to get really, truly adequate informed consent. So I'll mention a couple of questions, and then you can see for yourself where these difficulties are. So, for example, how do you ensure that the prospective participant has the sufficient capacity to provide consent? Suppose the patient seems to be mildly retarded, or was having a heart attack while you're trying to present this information, or perhaps had just been raped. Now you want this person to be able to listen to what you're saying and read a 10-page, single-spaced, informed consent form, and really be able to understand what the experiment is all about. So I believe under these circumstances, people are vulnerable, and it's hard to give informed consent. A second question: can a desperately ill person make a rational choice whether or not to participate in a clinical trial if that clinical trial holds out the prospect of cure or treatment? If someone is dying of cancer, a researcher comes along and says, you know, we have something now that's available, a new clinical study and treatment study, and we think that it offers a good chance for you. Well, it'd be pretty hard for a person not to say, yeah, let's try it. Another issue is how much information is adequate and needed for making a decision whether or not to participate in the trial. If you give really, truly, and complete informed consent, sometimes you present the risks and they sound so overwhelming that who would want to participate and take the chance? So people tend to downplay the risks and overplay the benefits, and that can be very destructive. Then there's the question of whether prospective participants really understand the design of a randomized controlled trial. You know, this is a trial where by a computer or by flipping a coin, people are assigned either to the experimental group or the control group. It's completely random. No one can decide which group to be in.